Welcome to this webinar on managing malnutrition, information to support people managing malnutrition at home. Today's webinar team is myself, Leslie Harper. I'm the nutrition support lead for community hospitals and care homes in Somerset, and my colleague Leah Seamark is the dietetic lead for our gastroenterology service, and we are both community dietitians who work for Somerset NHS Foundation Trust. So this webinar will teach you about malnutrition and how it can affect you, how to identify if you may be at risk of malnutrition, tips on managing malnutrition, monitoring your progress, and how to seek further support. So what is malnutrition? Well, essentially it means poor nutrition. But it can refer to those who are undernourished, so those who don't have enough nutrition, and those who are overnourished, so who have more than they need. It usually refers to a lack of either macronutrients, energy, protein, or fat, or micronutrients, vitamins and minerals, or it could be a combination of the two.
Now, lots of things can cause malnutrition, specifically undernutrition, and that includes inadequate diet, so not eating enough, a poor appetite, increased requirements, which may occur if you're recovering from an illness or infection, as well as any sort of gut problems, which means that your bodies can't absorb nutrients from your food properly. Now, there are lots of things which can contribute to these causes, and that may include recent stays in hospital, long term health conditions, lack of mobility, low income, bereavement, and also social isolation. Now, there are lots of reasons why we want to try and avoid malnutrition because it has lots of consequences which can have an effect on people's daily lives. So, if you're malnourished, the likelihood is you'll experience low energy levels, which can affect your ability to do day to day activities. It can reduce your muscle mass. And when you combine these together, it can increase your risk of falls. Now, malnutrition can also increase the likelihood of illness and picking up infections. And if you were to get poorly, if you're malnourished, not getting the right nutrition, it can take you longer to recover from those illnesses and infections. Malnutrition can also have an effect on your mood, so it's more likely that you may experience low mood. And when you put all these things together, it can actually make it quite difficult for some people, especially the more elderly, to continue independently with their daily activities. Now, there are a few symptoms that we want you to look out for because they're potential red flags which you'll need to discuss with your GP. So, if you're experiencing weight loss without any obvious cause, if you have any change in bowel habits or rectal bleeding, or if you're experiencing any difficulties with swallowing, so for example, coughing or choking during or after eating or drinking, we would recommend that you discuss these with your GP as it may be that they require further investigation.
So how do we identify malnutrition? Well, there is a tool that has been developed by BAPEN, which is available on their website, malnutritionselfscreening.org, where you can identify your risk of malnutrition by entering your current height in either metric or imperial and your current weight, and then your weight 3 to 6 months ago. And this will then calculate your risk of malnutrition and will identify you as either high risk, medium risk, or low risk. And this resource is also available on the website, which gives you useful hints and tips to help you reduce your risk of malnutrition. So, another tool which you may choose to use is the nutrition checklist. This tool has been developed by the Patients Association and can be helpful for those who are unable to weigh themselves to identify if you or someone you care for may be at risk of malnutrition. The tool consists of 4 sections. Section A asks 4 questions which you should ask yourself. Question 1, are you concerned you may be underweight or need nutritional advice? Question 2, have you lost a lot of weight unintentionally over the last 3 to 6 months? Question 3, have you noticed that your clothes or rings have become loose recently? And question 4, have you recently found that you have lost your appetite and or interest in eating? So if you answered yes or don't know to any of the questions, then you may be at risk of malnutrition. So, if you answered yes or don't know, then we would recommend that you complete section B of the checklist, which asks you more about your situation and needs. Section C then gives you advice on next steps to take depending on your answers and concerns. And then section D offers tips and ideas about eating to support you in reducing your nutritional risk. To see the checklist in full, go to www.patients-association.org.uk and look for the nutrition checklist for patients. So, how to manage malnutrition?
So, if you've identified yourself or someone you care for being at risk of malnutrition, it's really important to put some things in place to try and manage that risk. Now, the first thing we'd recommend is to add food toppers to each meal. So, a food topper is a food which is usually high in nutritional content. For example, it could be high in energy, protein, or other nutrients such as calcium, iron, or vitamin C. And the idea is that we add these toppers to the food that you're already eating, and it therefore makes each mouthful of food that you're consuming more nourishing. It increases the nutrient content of a meal without increasing volume, which is really important if you're someone who's suffering with a poor appetite. And also, it can make the food more palatable, therefore, increase the likelihood of you managing to consume it. And it's all about trying to make each mouthful count. So here are some examples of some good food toppers. So we've got cream, which you could add to things like porridge or serve it with fruit or cake. Cheese, which is a really good source of nutrients, so whether it's grated on pasta or potato dishes. Dried milk powder, and we'll talk a little bit later about how you can use that to fortify milk. Condiments such as mayonnaise, as well as chutneys and pickles. Condensed milk, butter, sweet condiments such as honey, jam, fruit compotes, and nut butters, and cream cheese. So, just to go through an example of how you could use these toppers. So, if you take a bowl of porridge, which you may have for breakfast, if you add a tablespoon of honey to that, which provides an extra 60 calories, as well as mix in a couple of tablespoons of double cream, which provides about 140 calories. When you combine them together, it means that bowl of porridge has about an extra 200 calories compared to what it was before. So it's a significant amount of calories which can add to your intake by just adding those couple of toppers. Now, if we would look at a sort of a standard meal, so if you took a meal of salmon and mashed potato with vegetables, if you were to melt some extra butter onto the potatoes as well as onto the vegetables and serve it with a tablespoon of mayonnaise, again, that provides an additional 200 calories to those meals. So, what we would recommend if you're at risk of malnutrition is to try and include at least one topper to every meal and pudding that you are consuming.
So, step two is aiming to have 2 to 3 snacks each day. So, this supports with a little and often approach, which may suit some people, and particularly for those who may have increased requirements. These are a number of snacks which may be available to you, which can provide you with extra nutrition. So, for example, we've got cheese and biscuits, full fat, thick and creamy yogurts, a slice of fruit loaf or malt loaf, biscuits, mini pork pies, bananas, rice puddings, and custard pots. And these numbers here just show you the rough calorie content of each of those snacks. We've then got texture modified snacks. So if you require a texture modified diet, then these are just a few foods that you could use if you have a texture modified diet. But you will need to ensure that you follow the IDSI guidance to ensure that they are a suitable texture and consistency, as some of these may require mashing, liquidizing, or combining with other snacks to ensure that they are suitable.
So, Leslie, when you mean texture modified diets, that's things like maybe a puree diet or soft diet, fork mashable diet, is that right?
Yeah, so they used to be called fork mashable, soft, etc. But then some new guidelines that came out in the past couple of years called IDSI, which stands for the International Dysphagia Diet Standardization Initiative. And this gives clearer guidance on how to achieve the appropriate texture and consistencies for the recommended IDSI level of diet and fluids. I would suggest that you go to their website for more information on this. So that's www.idsi.org.
Now, in terms of snack, we're recommending trying to include 2 or 3 nourishing snacks throughout the day. Now, if you're someone who doesn't typically snack, it can be quite helpful to try and have some visual reminders. So, have a little think about where you spend most of your day. So, whether it's in the kitchen, the lounge, the garden, and it can be helpful to keep a small supply of those snacks in those areas, just to act as a visual reminder to you, but also it helps reduce the effort required to actually get up and go to the kitchen to get the snack. Now, you're going to need to make sure that those snacks that you keep out are suitable to be kept at room temperature, and you may need to consider keeping them in a container to keep them fresh.
So, step 3 is include nourishing drinks. So, we recommend that you aim to have at least 2 nourishing drinks each day between meals and before bed. These could be drinks that are made with fortified milk, which I'll talk about on the next slide. Additionally, you can make homemade milkshakes. These are a great way to supplement your existing diet by providing a nourishing drink. They're easy to make and can be packed with nutrients. We encourage that you have variety and also make them as nutrient dense as possible. So, how do you make fortified milk? Well, you add 1 pint of whole milk or full fat milk and you mix in 4 heaped tablespoons of dried milk powder. This adds an additional 200 calories and approximately 22 grams of protein to the nutrition which is already in that pint of milk. Common brands of dried milk powder which are available include Marvel, Nestle Nido, or supermarket own brand versions. And you can then use this fortified milk for all your milky drinks and cereals. Other examples of nourishing drinks include hot chocolate made with whole milk, perhaps med added cream added. Coffee, so instead of adding a dash of milk or having it black, try and have it with all fortified whole milk, so a bit like a latte. You could then use Nesquik, Horlicks, or own brand vitamin shakes as a base for a nourishing drink. So, this is where you can make them up with full fat milk, perhaps adding in some ice cream or even some pureed fruit for extra nourishment. Or alternatively, you can buy over the counter supplements such as Complan and Ames Retail.
Leslie, those over the counter supplement drinks that you've just mentioned, where can you purchase those from?
Yeah, you can get them from a variety of places. So most chemists will stock them. A number of supermarkets usually have them too, and you can also freely buy them online at various websites. So these are just some of the recipes which we have in our handouts on our website, Patient Webinars. There are also a number of resources available from Bacon, which we have uploaded to our website also, and we also have some plant-based recipes available for those who are on a milk or dairy-free diet. If you're on thickened fluids, ensure that any nourishing drinks you make are thickened to the appropriate consistency. Now, this is just an example of ways of fortifying your diet. So, we have a breakfast, mid morning snack, lunch, mid afternoon snack, supper, and an evening drink. And we add toppers, a couple of snacks, and 2 nourishing drinks. So, for example, to the porridge, we add cream and honey. To the coffee, we make it all with fortified milk. And then to the lunch, we add melted butter to the vegetables and some jam to the sponge pudding and custard. We then add in a homemade milkshake along with our cake. And to the scrambled egg, we add butter and serve it with ketchup. And then to our hot chocolate in the evening, we add some extra cream and cheese and biscuits. All of these small changes can add quite a significant extra, so approximately 1,200 calories to your existing diet.
Okay, so step 4, if you're trying to manage a risk of malnutrition, is that we would recommend you avoid any low fat or diet food and drinks, and therefore opt for the full fat versions of products. So, if you require this type of diet for the longer term, you may wish to discuss this with your GP, who may refer you to a dietitian for further support. Step 5 would be to choose quick and easy to prepare nutritious meals and snacks. Now, if you have a poor appetite, the thought of going in and preparing a big meal may be quite overwhelming. And even if you do that, you may feel by the time you've cooked it, your appetite for it has gone. So, trying to prepare quick and easy meals is a really good way of ensuring you get some of that nutrition. So, something as simple as a jagged potato with tuna mayonnaise or jagged potato with cheese and beans or scrambled egg on toast are really good, quick, easy to prepare meals which are still as nutritious, as well as some of these snacks highlighted here, such as fruit malt loaf, cookies with a glass of milk, flapjacks, and cheese and biscuits. Now, it's a good idea to try and keep your store cupboard stocked up with some of these nourishing snacks. And the British Dietetic Association have produced this leaflet, which includes ideas for nourishing, long life foods for the cupboard and the freezer. And you can download that from the British Dietetic Association website, and we'll also put a link on our website. You may also want to consider ready meals, and they provide some benefits from the fact that they provide a nutritious meal, which are easy to prepare. So often they just need heating up in the microwave or the oven. This therefore takes the pressure off you cooking, and it can help support people in their own home. And there's a wide range of these ready meals available to suit lots of people's taste preferences and individual needs. Now, you can get some ready meals from lots of different supermarkets, but also you can get some home delivery of these ready meals from providers such as Wiltshire Farm Foods, Oak House Foods, Parsley Box, which includes ready meals which can be kept in the cupboards, therefore don't need to be kept in the fridge or the freezer. So if you're limited on space, that can be quite helpful. And also Cook provides some ready meals as well as supermarket owned brands.
So, if you use ready meals, then there are a number of ranges available for those who are at risk of malnutrition. If you're on a normal textured diet, then you may want to consider the Mini Meals Extra range from Wiltshire Farm Foods for those with small appetites. And for those who have good appetites, then you may want to consider adding the food toppers, which we discussed earlier, to those regular meals. For those who are on texture modified diets, then you may want to consider the Puree Petite range from Wiltshire Farm Foods for those who have thick puree or level 4 diets and who have a small appetite.
So, Leslie, how much smaller are the pureed petite meals?
They're quite significantly smaller. They're about 40% smaller, but they contain quite a significant amount of nutrition, at least 500 calories and 20 grams of protein per serving. Unfortunately, there are no petite ranges for the other levels of texture modified meals. So, for example, 3, 5, and 6. This does not mean you cannot fortify them. However, caution must be taken when adding toppers to any texture modified meals, as this process can alter the consistency. So, you really need to ensure that you check this to ensure that it is safe and compatible with your needs.
So, step 6 of managing malnutrition is that if you feel your dietary intake is quite limited, you may want to consider a multivitamin and mineral supplement. Now, general recommendations are that adults and children over the age of 1 year old consider daily supplementation of 10 micrograms of vitamin D daily, especially during the winter and autumn months. Also, if you're in self isolation or have little access to sunlight, you would want to consider a 10 microgram supplementation of vitamin D. But also, if you're at one of the at risk groups, you may want to consider 10 micrograms of vitamin D all year round.
And Leah, who might be in those at risk groups?
Okay, so that includes people over the age of 65 years. It also includes people with darker skin tones and people who may cover up their skin when they're outside. But there's more detail of these at risk groups and other categories that fall into these at risk groups on the vitamin D fact sheet, which you'll be able to download as part of this webinar.
So, moving on to monitoring your progress. So, ideally, we want you to weigh yourself and about once a week, make a note of it so you can monitor any changes to your weight. I would suggest using a reliable set of scales either at home or if you can access one at your local chemist. Also, it's important to note any observations. So, particularly for those who, if you're unable to weigh yourselves. So, for example, if you notice any increased fatigue, nausea, vomiting, loose fitting clothing, or a noticeably reduced intake which isn't improving. And then we would suggest bear in mind that a fluctuation of less than 5% body weight can be normal.
And Leslie, why would a weight fluctuation of 5% be considered normal?
Yeah, that's a good point. So there are a number of variables, including, for example, the time of day. So we're usually lighter in the morning, when we last opened our bowels, and also how much we've drunk. So we would suggest looking at the trend of what our weight is doing rather than focusing on just one weight in isolation. If you are concerned, then we would suggest that you discuss these concerns with your GP. And this is particularly important if you notice ongoing weight loss, or you notice any new symptoms, such as the red flags, which we mentioned earlier, or if you have a medical condition that requires a special diet.
Leslie, what do you mean by a special diet?
So, for example, it could be people who have kidney failure or renal disease, those who have uncontrolled diabetes, those with celiac disease, or other gut related conditions where they have been advised to follow a certain type of diet, which may contradict with the advice that we've given earlier. So, for that tailored advice, we would just suggest that they discuss that with their GP, and their GP may consider a referral to a dietitian for further support.
So there are a few useful handouts which you can get as part of this webinar. So on our website, www.patientwebinars.co.uk, if you click on the malnutrition topic, and you'll find the handouts under further information and handouts.
And then next we talk about end of life nutrition. So I think this is a really important area to touch on because we often don't talk about this enough. Symptoms such as a reduction in appetite, a loss of interest in food or drink, or refusal can often be a symptom that those with life limiting illness may be approaching the end of their life. These symptoms are often a natural response and an expected part of the dying process when the body starts to slow down, and most in this stage of life do not experience hunger or thirst. Aggressive nutrition support can often be distressing and may cause discomfort and is often not appropriate in these situations. Sometimes people ask for supplements at this point, but prescribed supplements do not contain anything which cannot be found in ordinary food. It's natural for carers and loved ones to be concerned, but food is much more than simply nutrition. Food for pleasure is more important than the nutritional content at this stage. So, we would encourage small amounts of food and fluid for pleasure, and perhaps offering drinks in small cups may help with ease of drinking and not having to tilt the head back so much. And smaller portions or tastes for pleasure may be preferred.
Are there any handouts which could be given to carers or loved ones about this?
Yes, there is. The British Dietetic Association, so the BDA, have recently produced a very good handout on advice for carers supporting people in end of life nutrition. This is available on our website, Patient Webinars, and it's also available on the BDA website. So, just to summarize, malnutrition is usually treatable if it's identified early. And simple dietary changes can often slow weight loss. For example, little and often approach, adding food toppers to meals, extra snacks, and nourishing drinks between meals. It's important to monitor any changes and alert your GP if your weight loss continues or if you notice any of the red flags that we discussed earlier, as this may require further investigation or alternative nutrition support measures. And don't be afraid to ask for further support. Dietitians are registered health professionals, and we are able to provide tailored dietary advice to support your individual needs, and your GP can refer you to a dietitian. So, lastly, thanks for listening, and we hope that you have found this webinar really helpful. Don't forget there are a number of handouts which are available for you to download and print off as you wish, which are available on our website, www.patientwebinars.co.uk.